Brittany. It's nice to see you. How you been?
Yes, I've been good. Yeah, I
Yeah.
think, we were just talking about how it's been 10 years since we saw each other. And I feel like so much has changed in those 10 years. I think for me, I've been through so many different things, some really cool, amazing things,
hmm
and also some really hard things. So it's been interesting reflecting because I just turned 25. And the last time, we saw each other was like 2016 filming Backstage. That was
hmm
like, one of the
Different
highlights.
life. Different
It
life,
was
I
a different,
feel. You know?
yeah, yeah, it was, yeah, like for me, being on Backstage was a high point. Acting and dancing, that was something that I wanted to do for a really long time. And a couple years after that, I feel like my health really started to decline, and everything I had worked towards up until that point just fell apart. And that was an incredibly difficult thing to go through at like 18 years old.
Yeah.
And since then, I'm 25 now, and I've been through so much, and it's just been so great to reflect on all the amazing things and all the hard things, and I just feel very grateful to be where I am today, and that I'm healthy and I'm
Yeah.
living my dreams once again, because there were very dark periods of my life that, working on Backstage and being an actress, I couldn't have foreseen that happening
Yeah.
to me.
I bet. Did you want to talk a little bit about what you went through with your physical health?
Sure, yeah. Um, so I was born with a health condition called cystic fibrosis. It's a genetic condition. And so I was born with a distended abdomen. So that was like an indication that something was wrong. I was operated
Mm.
on at a day old. I have a scar on my stomach from that operation and surgery. And from there, I was in the hospital, the NICU for about 2 months. So
Sorry,
I
you
didn't
said a.
actually,
Sorry to cut you
yeah,
off. You said a day old. You mean like when you were born? This is
when I
like
was
from the
born.
beginning. Okay,
Yeah, yeah, I had a
got it.
surgery when I was literally a day old.
Mm.
So I had like a rough intro into the world, and my parents were told that I'd be lucky if I lived to see my 18th birthday.
Mm. That's hard.
Yeah, and so I think my life was set up for a lot of adversities. And luckily, I had a really great quality of life for someone living with this health condition.
hmm
I was a competitive dancer. Yeah, I competed at a very high level. I got my black belt in karate when I was 12. Um, I won my track and field competition when I was 10 years old, which was incredible because cystic fibrosis affects the lungs,
Mm.
and it's a fatal disease. Like, a lot of people die from it, and that was something that was kind of predestined, was an early death for someone who lived with cystic fibrosis. And for me, it started to get really bad when I turned 18. So right after I filmed the second season of Backstage, I could feel my health starting to decline a bit, and then it just like really rapidly got worse. I had chest infections every 3 months. I was on like really heavy antibiotics. And by the time I was 19, I was 88 pounds. I could barely walk.
Mm.
I like there was like months and months where I was just like on my couch, barely conscious, and then when I was conscious, I was vomiting, and when I wasn't vomiting, I
Mm.
was coughing up blood. And it was like it was hard. Like, that was one of the hardest things to go through, and it was really hard on my family too, because I looked like I was dying.
Yeah.
And there was a level that yeah, I was. And from there, I had to really figure out how to get myself out of that. And because what was causing all of this was I had infected tonsils, believe it or not, and that was making my health condition
Mm.
worse. So it was causing all these chest infections. And I mean,
Interesting.
chest infections are normal for someone with cystic fibrosis. But for me, it was just getting to a point where it was out of control. Um, so I had to
What?
get my
Sorry to cut
tonsils.
you off.
Yeah, cut
What do
me
you think?
off. Cut me off.
No, I like hearing what you're saying.
Yeah.
What do you think initiated that whole, like, I know you grew up with it and you had that growing up. I assume it was pretty balanced and stable in some ways growing up.
Yeah.
So when 18, like when you turned 18 and then started getting those symptoms, what do you think was like the main reason why it just flared up as hard as it did?
Yeah, I honestly don't have a clear answer. From what I've heard from the doctors is that that age is really difficult for CF patients for some reason. It just gets
Mm.
really difficult. I think for me, honestly, like for a girl, getting my period actually was something like I got it really late. So I was 16. So
Oh.
then by the time I was 18, I think, and they actually talk about this, how females with cystic fibrosis have a harder go of it because your cycle actually fluctuates your lung function in a way. So it just,
Mm.
for some reason, it just really,
Well, your hormones are up and down, no? So
yeah.
I
So
feel like that would
yeah.
contribute to it.
Yeah. And I think just also with cystic fibrosis, you contract viruses in your lungs. So there's a virus called B. cepacia that cystic fibrosis patients have. And I was one of those cystic fibrosis patients who had it. So it just kept creating reoccurring chest infections that would never
Mm.
properly get out of your lungs because cystic
Yeah.
fibrosis makes the mucus in your lungs thicker. So it makes it harder
Mm.
to breathe, and it makes it easier for viruses to get stuck. And then it also makes it easier to accrue lung damage. So like those three things are really what, like there's cystic fibrosis patients who have to have lung transplants because their lungs just can't
Don't function.
function. So like my
Yeah.
lung function got down to 50% ish, which was
Mm.
a healthy lung function is 70 to 90%.
That's
So
crazy.
yeah, so that's and the way cystic fibrosis works is that it is a fatal disease, so it just progresses over time. It just gets worse and worse. You just get more lung damage, you get more chest infections. Because of the chest infections, you get more lung damage. Um, it's a really vicious cycle.
Cycle. Yeah.
Yeah, so that's just really, I mean, and then your body just gets worn down from all the antibiotics because they put you on really strong antibiotics, which
Well,
is,
you get immune to it.
well, it's not that you get immune to it, it's that the antibiotics really affect your gut health and your immune system.
Yes.
So
Yeah.
it just like, it's just this, and I was caught in that cycle. So it was, and what I did to try to get out of that, which helped a little bit, was this breathing. It's called Buteyko breathing, and it helps. It's like breathing through your nose. Like I'd mouth tape at night. I feel like everyone talks about this, but I was doing this like 6
Breath
years
work, kind
ago.
of.
Yes, breath work to
Oh, okay.
help improve your lung function. I do like chanting
Yeah.
and meditation and all this kind of stuff. But the thing that really changed my health was this drug called Trikafta that became available a couple years ago for cystic fibrosis patients. And when I was born, the doctors told my parents that this drug would become available in my lifetime. So this drug improved my lung function. Like I think when I started the drug, it was at 61%, and then after
Hmm.
starting it, like within a week of starting it, it was at 81%, which is insane. Like that's just
Yeah.
ridiculous. So that one drug completely eliminated my cystic fibrosis symptoms, but there were like 5 years prior to that, from like 18 to 23, that was just absolute hell to live through prior to that
Yeah.
drug.
I bet.
So I'm lucky that, I got to start this drug because I don't know where I would be if I hadn't started it. And that was a whole thing in and of itself, because when I started the drug, it was really weird because I was in the best health I'd ever been.
Hmm.
And all of a sudden, all this stuff came up mentally for me that I hadn't had the capacity to deal with because I was in survival mode for 5 years. Like I couldn't
Yeah.
audition for stuff. Like there were years where I couldn't even audition. Like I was acting, I'm going to all these auditions. I couldn't do that. I couldn't, like my whole life shut down because every day I
Mm.
was just trying to get through each day, like just trying to survive. I also had like super severe depression. Like I was as depressed as you could be without being suicidal. Like I was super depressed. My mental health was terrible. My physical health was terrible, and understandably, because I felt like I was dying alive from this condition. So when I started this drug, it was interesting because I think on the outside, the doctors thought, okay, well, she starts this drug, her lung functions got up to 81%. She should be having the time of her life. And I had never felt worse mentally. Like it was such a bizarre feeling.
Do you think the drug made you that way
I don't think it was I
mentally?
don't think it was the drug. I think it was the
Did it,
circum.
sorry, not the drug. Do you think that taking it contributed to that mental state that it brought you?
Yes, and I don't think taking the pill in and of itself caused it. I think that what it did was that I was finally out of survival mode and my body was finally safe. Like if you ever watch a
Mm.
survival story, and that person's just like trying to just get by. And then when they
Hmm.
finally get through it, there's just, or even I like to use the analogy of like an athlete. Like if you watch, I don't know if you watch tennis or boxing, and the whole time that athlete's just trying to like throw punches, hit the ball back and forth, whatever it is. They're just trying to stay in the match. And that was those 5 years for me, 18 to 23. I was just trying to hit that ball back and forth. I was trying to stay in the game. And this drug enabled me to actually win the match. And when an athlete wins a match, they collapse out of like physical, emotional, mental exhaustion. Like they were trying to keep it together that whole time. And for me, that was those
Yeah.
5 years. And so when I started that drug, there was something inside of me that just collapsed. It was just like pure exhaustion, right? That burden
Do you
had
feel
been
like your
lifted.
body finally, yeah, I was gonna say, do you feel like your body released it finally, but it didn't know how to
Yeah, what
structure itself to just stand up, kind of?
yeah, well, I think there's this book called The Body Keeps the Score by Bessel van der Kolk, and it talks about trauma. And it was one of the first early works of, it was written in the 90s. And this is when they started to, actually my friend, for because I've been working in a mental health nonprofit for the past 6 years. So my friend who founded this nonprofit shared the book with me. And it was really helpful because it put to words what I was going through. Because they talk about in the book how trauma is when you don't have agency in a situation. And
Mm.
as much as I tried to create agency for myself when it comes to a health condition that's trying to kill you, it's hard to feel agency. And so I just had so much trauma from that experience that when I finally took this drug, all the trauma came up because I didn't have the capacity to deal with.
I get that.
Yeah, so
Yeah.
it was like a year of therapy and working through all of that. And I really only like feel like I've fully gotten through it just in the past like 6 months to a year. So it's just been because I just started this drug in 2023 of January. So
Oh,
it'll
okay.
be 2 years this January. So it's quite new for me, this whole reality. But yeah, it's been a wild, crazy journey.
You were talking about like how you had your tonsils. Like you said it was affected.
Yes, yeah,
So I watch a lot of like health videos and everything. I'm like my brain's all over the place, so I like all
yeah.
topics. I hear a lot about like how your mouth health is really important to your overall health.
Okay, yeah.
So when you went to the dentist or whatever and you saw that your tonsils were inflamed or infected, did they talk about that for you with you?
No, so how I discovered it.
Speaking about like what you eat or what
Yeah, well, I know
you
flossing is
know?
good for it's important to floss, right? Like people talk about that.
Yeah.
But for this, it was actually a breathing practitioner I was working with while I was really in that low point where I was like 88 pounds. We were talking with her, and she's the one who suggested that maybe I had infected tonsils because every day I was waking up with the same, like really green mucus, like every single day. Like just like it
Mm,
didn't matter how much I got out, it just like it was like Groundhog Day. Like it just was like every
mm.
single day. And we told her that, and she actually had infected tonsils, and she suggested I get it checked. And I went to a bunch of different doctors in Canada, and they all didn't think that I had infected tonsils because with this particular kind of infection, it was on the inside, so you couldn't really see it from the outside. So
Mm.
I had to like fight to just try to like beg these doctors to like take my tonsils out, and they refused. So I had to go to the States. And luckily this,
Sorry to
yeah,
cut you
go
off,
ahead.
but like how how frustrating is that like
Yeah.
you have these people that, they're really about health and trying to get you to a place and it's like how by the book do they have to be for them to really miss
No,
that?
I know, yeah.
Like you said, like I know some people are very exaggerative and I can understand them being in lots of situations where someone's actually okay and they're not whatever they're thinking and they're just thinking it, but then there's other patients or people that are actually going through something. There's like, no, there's something wrong. And it's like always till that last minute where it's just like, finally, you actually gave me the help. Or in some cases, unfortunately, they either pass or get really, really sick. So like, how was that for you? Because like, I would be
Yeah,
pissed,
no, I was.
you
Yeah,
know?
definitely. There was definitely it was frustrating. And I encourage people to be your own advocate as a patient. Because I had to go. I grew up going to the hospital every 3 months for checkups with this health condition that I have. So, frustration is an understatement with a lot of the situations I found myself in. And with this, luckily, we just got really resourceful, and luckily we found someone who had their tonsils operated on, and it was this particular doctor in the States. So we went there, and I got it checked by this doctor. He was like, "Yep, you definitely have infected tonsils." He knew what to look for, and I got a surgery to get them removed. And after the surgery, the doctor said, "Thank goodness you got them removed, because it was like couscous inside your tonsils. It was like terrible." So that was, yeah. But I think it's interesting. Like, my relationship with the healthcare system has been interesting, because on the one hand, I understand where doctors are coming from, and it's important to come from a place of compassion and empathy with where they're coming from instead of judgment, because I understand that even with the tonsil thing, like, some of those doctors were like, "I'm liable if whatever." So some of them are afraid, and I totally get that. They don't want to risk. You just need to find the doctor, the person that's willing to help you. If this one person isn't willing to help you, or get you what you need, you just have to keep going and finding the right person. And
I
yeah.
think you know what's hard about that. I may be wrong. People can correct me on it. What I understand with doctors, when you get into your field, it's so specific. So like a urologist,
Right.
you know what I mean? Like
Yeah.
they're very specific, and it's just very tunnel vision in the sense where like it's hard to find people that are well rounded because they're not actually trained to be well rounded unless they do the research themselves, or like, again, the liability thing like that. So imagine like being a doctor and they're like they know what you should do, but if they say that, they could get in trouble. And just like, what kind of system are we in or putting ourselves into if it's like that? It's like, how can, like, I don't like, what do you think of that? Like, is that a struggle for you to be like, has it changed your opinion? I know it's helped you in so many ways, but has it changed your opinion and your perspective on the healthcare system?
I think there's a lot that can be done to make the healthcare system better, for sure. I think everyone's doing the best they can. And I think when it comes to Canada's healthcare system, I think that since we are funded in a particular way, there's only so much funding available. So there's a lot of disorganization, unfortunately,
Mm.
and it's not necessarily the doctor's fault. And I think also I used to like expect the doctors to, like, I go to specialists, right, who are specialized in cystic
Hmm.
fibrosis. And I used to expect them to understand where I was coming from a mental health perspective, from a holistic health perspective, like talking about, "Oh, I want to take care of my gut health." And the doctors would be like, "Well, there's no proof that antibiotics affect your gut health." And my argument would be, "Well, then why do I feel depressed whenever I
Why is it
start
messed up?
them?" So and I
Yeah.
would get into like, but it's like, I got to a place where I was just like, what's the point? Like, why am I trying to change their perspective? I just need to find a way to take care of myself and take responsibility for my health, and not put that on doctors who specialize in a particular area. Like, they're not as someone who specializes
Mm.
in cystic fibrosis, for example, is not going to specialize in holistic health, in gut health. That's just not what
Yeah.
it is. So for me, it was a lot of like, there were many years where I had to trial and error, experiment with a bunch of different alternative treatments to try to heal my gut
Mm.
health, to try to take care of all these other aspects of my health that were important to me. Because when you have a health condition, especially, a lot of times they only look at you through that specific lens. They only look at you through someone who has cystic fibrosis. And sometimes it doesn't really feel like you're even being seen as a human being, which is weird. Like, I remember, and I understand, like, they're all being trained and but a lot of times it just felt like they forgot that there was a human in the room, and they would talk about me as if I was
Mm.
like not there, and say really,
Like a dummy, kind
no,
of.
yeah, just like they didn't.
Not a dummy up here, like a
Oh, like a
practice dummy,
practice dummy.
yeah,
Yeah, yeah.
yeah,
No,
sorry.
no. Yeah, no, exactly. Like, it was yeah, it was hard. Like, those situations are challenging, for sure, because but again, it's just one of those things that helped me, was just taking responsibility for myself and not putting that on other people, and finding ways to process my anger and frustration in other ways, because I nothing I could do would change their behavior. And there were some amazing doctors, and there were some not so great. And they were, when I say not so great, I don't mean competence in their particular field. I mean bedside manner and empathy and communication. Luckily, Canada has amazing doctors. I think we definitely have, like, especially the Cystic Fibrosis Clinic in Toronto is amazing.
Mm.
I just think that communication could be better. I think that communicating with a sense of empathy and understanding of what you're saying, because a lot of times there was like very harsh information being delivered to me, very disturbing information, and I don't think it was always handled in the most empathetic way. And that's
Yeah,
really
I get
challenging
that.
as a patient to try to process and understand what someone is saying to you, and the delivery is not, um, it's not considerate. It's a lot.
And you're sitting in a room that you can't really get up, and the doctor just comes in and gets
Yeah,
out.
exactly. So I think it's just,
And you're just like,
yeah,
I wish I could just get up and get
yeah,
out
no,
like
it's
you.
it's true,
I get
and
it.
I would also recommend, if anyone's going to the doctors a lot, or have to, or don't like going, go with someone you trust, because a lot of times I would like zone out because something a doctor would say to me would be very disturbing and triggering, and my mom would, and I would like, my mind would literally just like block out.
Yeah,
Yeah, and
hyperspace.
I
Yeah.
luckily my mom would always go with me, so she was the other set of ears. Because when you're,
Hmm.
it's such a heightened situation, and especially when you're dealing with like a fatal disease or life and death, right? It's really hard. So luckily, my mom was there to listen when I couldn't, like when I was, not able to
Yeah.
really take everything in. So and also it's just good support too. It's so hard. I see some
Hmm.
young CF patients there when I go to the clinic, and they're like 18 by themselves, and you're there for hours. Like you have to get blood work and chest x-rays and this and that. And they're just all by themselves, and that's so hard. Like, and it's no reflection of you. Like, it doesn't mean you're a weak person. It's actually strong to reach out for support if you can get it. I'm lucky enough that my parents
Yeah.
work from home, so my mom can be there for me. But not everyone has that option. But if you can, I would highly recommend that you do
Yeah, for
that.
sure. So you took a, I don't want to say a switch, but you kind of dived into the world of holistic remedies and medication or whatever. What's your experience been with that and your understanding, and where are you at with that? Because I know there's very much polar opposite sides to it. One side says one thing, the other side says the other.
Yeah,
It's like, what's your experience been with that? Because I know a lot of people are like, especially after like COVID, I think a lot of
right.
people have opened up to different ways of taking care of their health and understanding what health is and where it comes from. Because even like when you talked about your gut health, like your gut health is part of your immune system, and your immune system's not eating celery, having celery juice every morning, a little bit of ginger. You know what I mean? Your immune system is your mind, your body, and your spirit at the same time. It's a big ecosystem. So like, what's that been like for you?
Yeah, I think my journey into, I'll start with spirituality, because I think that is kind of, encompassing a lot of things. So for me, spirituality started for me when I was 14. I had been hospitalized right before the Dance Awards in 2014,
Mm.
and it was devastating. And I had to get a PICC line in my arm, so I literally was like, in between my training sessions at dance or like rehearsals, I would go to my parents' like van, and they'd hook me up to IV, and I'd have
Oh
IV
my
going in
God.
through my arm, and I'd be like chugging pretzels, and then 20 minutes later, take the IV out, keep the PICC line on, and go back into training. And that was insane. And I was so, like, that year I burnt myself out. Like, I was in
Mm.
every dance number across every age group and age category.
Yeah,
And
yeah,
like, you probably
yeah, for
saw me
sure.
in everything.
I remember. Yeah, yeah.
But when I got to the dance awards, that was 2 weeks after being really heavily medicated on those antibiotics for weeks, and I did not feel good. I
Do you feel like a ghost
and yeah, like you
a
almost
little
a
bit?
little bit. I was just like, I remember performing my solo, and I just was like, felt so shaky and off, and my body was exhausted. And I was going into like a really stressful, like from one stressful situation to the next in different ways, from the hospital to the dance awards. And after that year, I just realized, like, I don't want to go through that again. I want to prevent
Yeah.
this from happening. And
How old were
I
you?
was 14, 15,
14.
14, 15. Um,
Did you stop dancing after that year?
no, it was when I was 16.
Oh, okay.
Yeah.
So that's grade 10.
Yeah,
Yeah.
grade 10. Yeah, so that was grade 9. And my mom recommended this book called The Gifts of Imperfection by Brene Brown. And so I read that. And that was really transformative for me because I'm a hardcore perfectionist. And I feel like that's
Mm-hmm.
part of what contributed to my burnout was just this like unhealthy relationship with perfectionism. And so I thought that was a really interesting thing for me to read because it taught me that vulnerability can be a strength. And from there, I just got this really huge amount of curiosity to read more books leading into spirituality. So I read throughout that year, so like my grade 10 year, I read a bunch of Deepak Chopra books, Don Miguel Ruiz, like the Four Agreements. And it really helped me manage to the difficult personalities I worked with at my dance studio. Because some of the it
The
wasn't,
culture.
yeah, it wasn't my peers. It was just more other factors that would be challenging. And sometimes you're like, why is this person behaving this way? Did I do something wrong? And one of the things I learned in the Four
Mm.
Agreements by Don Miguel Ruiz was to never take anything personally. And then learning that taught me that, oh, okay, like someone's behavior is not necessarily about me. So the more I learned, I saw it actually enabling me to perform better at dance, to have a
Mm.
better experience. And so that was what spirituality was kind of my gateway to enjoying the present moment more and not stressing
Mm.
out about all these uncontrollable factors. I started meditation. I tried this Silva Life meditation. I got like a Mind Valley subscription. Mind Valley's like that. I don't know if you've heard of Mind Valley, but
No, I
it's
haven't.
really cool. You'd probably really like it. They have like a bunch of really cool spirituality courses like meditation or
Mm.
quantum leaping or all these really cool things. So I just like explore that and see how I almost like experimented with it like a scientist. Like I'd try meditating before, I performed on stage and see if it helped me. And if it
Mm.
did, I'd be like, okay, this is something I should keep doing. So that was kind of like my intro into being more holistic from a mental health perspective.
Mm.
And from a physical health perspective, it was complicated because I did have a health condition, and cystic fibrosis affects your digestion too. And being a dancer, there was a lot of bloating that would happen, and it made me so self conscious. And I had disordered eating for many, many, many years. And like the pressure to look a certain way was amplified by the fact that I just literally couldn't look a certain way because of my health condition sometimes. So that was like super challenging. So I started to experiment with a bunch of different uh, eating, like not, I don't call them, I wouldn't say diets. Like I wasn't trying to like lose weight per se. I was just trying to see
Yeah.
if it would make me feel better.
Yeah.
And I tried a lot of different things, and some of them worked for a while and some of them didn't. But the biggest lesson I learned was actually after dance and when I started working at a mental health nonprofit. And
Mm.
that just opened up the world of mental health and how connected your mind and body are, and how important it is to take care of
Yeah.
your mental health because it makes your physical health better, and taking care of your
Mm-hmm.
physical health makes your mental health better. And there's just so many things everyone can do each and every day to make things better, or at least not make things worse for ourselves. If we just do a little bit of movement every day or get outside and get some sun, those are just really
Yeah.
simple things that I learned that I could really improve my quality of life with, because before I just didn't really think it was a factor.
Yeah. I think the hard part people have, I have my fair share in things like that. It's like, yeah, like you want to figure out how to be better, but sometimes it's not about adding more to what you have. It's kind of like taking a step back and being like, what's going on here actually?
Yeah.
Because like you said earlier, you talked about like learning that vulnerability is okay. It's like, where in your childhood did that start? I'm gonna assume you can tell me it was from the dance world because, like, I again being part of it, I had my different experiences. I'm a guy. Everyone has their different experiences with it, but like, just I'm gonna assume like it stemmed from there. And I don't know if you've taken the opportunity. I assume you have, getting into yourself and being like, oh, this is probably where it came from. Blah blah blah. If you want to share that, that'd be great
Sure.
because, like, I think a lot of people
Yeah.
don't understand
Yeah.
it.
And it's interesting too, Dan, because when I started reading spirituality books, I thought that just reading the books and applying what I was learning in the books was enough.
Just change. You're gonna change. It's gonna be
Yeah,
this and that.
exactly. And
It breaks you down, which is the
yeah,
hard
and I
part.
think it's one of those things too that it got to a point in my life where like it wasn't working. All the stuff that
Mm.
I was trying, it was not working. And so that was telling me that something deeper was going on. So going back to what our childhood wounds are, for
Yeah.
me, like I enrolled myself into therapy when I was 20. So that when I was 20, when I
Mm.
turned 20, I was like, and this was like right after, just like, I called it the summer, we call it in my family the summer from hell, but like that summer where I was down to 88
Everything
pounds
just
and
came
like
out.
I was
Yeah.
just not, like, it was terrible. Um, but I had a lot of time to reflect. I worked at this mental health nonprofit, like I mentioned earlier, and I was able to find the right mental health care for myself. And I think that's a really important thing on our journey of spirituality, which is funny because you don't think about mental health maybe when you think about spirituality.
Yeah.
And I think mental health, taking care of my mental health, going to therapy has been the most important thing to every area of my life, including my spiritual journey, including my spiritual growth, because you can't move forward unless you've addressed the stuff that's holding you back. And that's your
Yeah.
childhood stuff. And for me, there was a lot of stuff there. It
Yeah.
actually, dance was just the icing on the cake of adversities that I had been through. It just amplified stuff. For me, dance
Yeah.
actually was one of the least severe experience.
Problematic. Oh, okay.
Yeah, one of the least severe. It was problematic, definitely, but I think everyone can agree that anyone across
Yeah.
anyone who's ever been in dance, like I've spoken to people who trained in dance in Nova Scotia, in the States, and
Hmm.
everyone has this like universal agreement that it
There's a
was.
different spectrum of it for sure.
Yeah, and I just think
Yeah.
for me, like I was bullied in school for many, many years. And that's
Mm.
like, if I were to do it over again, I would have gone to mental health therapy. Like I would have taken care of my mental health right away and gone to therapy right after being bullied, because that was one of the things that scarred me the most. Being young, being like 8 years old and going through that, where
Yeah.
like your peers hate you and they go out of their way to bring you down and hurt you, and trying to just like survive every day at school. Like I would vomit before I went to school every day at
Oh
that
my God.
point. Like it was terrible.
And you're how old?
I was 8.
Oh my God.
It was
That's a lot.
terrible. So that's like what start for me. Like that was one of the hardest things I had gone through. And then one of my close friends, by the time I was 10, one of my close friends who was like the only like friend of mine outside of school that I felt safe with. Like it was my family and this one friend that I felt safe with, and she passed away from cancer when I was 10.
Oh,
So it was just like that. It was,
traumatizing.
yeah, it was devastating. It was, and
Yeah.
that's when I started dance. So dance actually became my therapy at that age. Dance became
Mm.
my way of processing my grief, of expressing my sadness, of channeling all the emotion that I was experiencing at school into something that was actually really positive. It was a really healthy outlet for me. And that continued. Like I didn't go to therapy until I was 20, like I said. So when I was in the dance world, in the thick of it, dance was my coping mechanism. It was like when I was
Yeah.
in hospital and being hospitalized, I didn't want to sit in a hospital room. I wanted to get out and dance because that's what made me feel in control. It made me feel capable. I didn't
Hmm.
want to just be some sick kid attached to an IV for 2 weeks,
Yeah.
lying in bed. And I had goals and dreams for myself, and dance was a part of that big goal and dream. So I think, yeah, like for me, the childhood trauma stuff, um, there was a lot of it, and it took me like 4 years of therapy to get through all of it. And
I think, sorry to cut
yeah,
you off.
no, go ahead.
I think the hardest thing to wrap your brain around, or at least that's what I do, is realizing that what you went through was a lot. I'm not saying you, just in general, what you go through in life is a lot, but it also means nothing.
Yeah,
And I don't know if you get what I'm saying. And like putting yourself in the middle to be like, because it's so nuanced. Like what you went through really meant nothing because it just what you perceived it as and what you created it as. And then what you actually went through is like what you went through. And it's like, where I'm at in my stage of my growth and stuff is kind of just like letting go of what happened, but understanding how it brought me to this place in life. And it's kind of to be honest, I feel up and down a lot of the times because I'm just like, I'm very, I use my brain a lot. I think about a lot of things, and like that's just how I try to do things. I try to intellectually piece things together, and sometimes it doesn't work out that way. But like for me, it's been like
yeah,
this puzzle makes no sense. It fits all together, but you know what I mean? It's kind
yeah,
of just like,
yeah,
and I think that goes into being a person who like just lets go and like let it flow. And even that's like a whole another realm because like what you talked about with like going through all that stuff, and if you went to a therapist when you were younger, like you, I don't know how you feel, but for me, knowing that I could have done that in my past, I don't hold on to it, but part of me is just like, shoot, like, things would have been a little bit different. And it's kind of just like the way I look into the future of myself. It's like, I've been in a place where I'm actually just not moving at all because I'm like thinking way too much
Right.
versus like just letting it flow. So
Yeah.
like, I guess my question to you, going off of that, is just like, how do you like find space to flow and
Yeah.
add your knowledge? Because I think that's difficult with anybody and
Yeah.
anything.
Yeah. I think overthinking is really normal for our age. I think that the 20s is a very anxiety provoking era for us. There's a lot to
Mm,
figure out. There's just so much that we have yet to understand about ourselves, about our life. And I feel like for me, what's really helped me is embracing what this decade is, which is exploration. It's a call to adventure of your life and
yeah,
embracing the uncertainty and embracing the fact that I don't know. Things can change. 5 years from now, I could be living in a different city with a different job, you don't know. And I think that's a really good
yeah.
thing. There's this book called The Defining Decade by Meg Jay, and she was a therapist, well, she still is, but for 20 years, she specialized in helping 20 somethings navigate their life. And it's all the things that
Mm,
she learned. And I highly recommend that book for anybody who is trying to navigate the 20s because I read it on my 24th birthday. 24 was a really difficult year for me because we also have
mm,
these expectations of ourselves in our life. And I think, and a lot of times, I don't know if you're the same, but for me, it's like, oh, I'll have this by the time I'm 23, or I'll accomplish this by the time I'm 24, or I think I'll be here by this age. And when we're not, I think subconsciously there's a part of ourselves that freak out.
yeah.
When I turned 25, I thought about my parents who were married with a house at 25. Even though I don't want to be married, even though I don't want to be married with a house at 25,
Yeah.
I don't want that. But there's a part of me that's like,
That could
wait a
happen. Why
second.
not?
Yeah, but also freaking out. Like, is there something wrong with me that there, like, am I living my life properly? And then add in social media for our generation, and you can constantly feel bad about yourself in your life.
Mm,
Constantly. So I think for me, what really grounds me is going inward. And for me, when I know when I need therapy, when something's coming up that is not going away. So if I do all my usual things, everyone has a kind of routine that they do or kind of a thing that they do that helps stabilize themselves and process their emotions and feel good. And if I do that in like within a week, it's not getting better. There's a certain thing that's just like, it's just not, I can't think my way through it. I can't move my way through it. It's just like constantly coming up. That's when I know I need a mental health professional to
mm,
help me sort that out. And that has served me so well throughout this decade of my life
yeah.
because some things you do need a mental health, like a mental health professional. Think about when you, like, sometimes you could almost look at childhood trauma as like an injury, right? And if you break your arm, you need a doctor to help you heal it. You can't just be like, okay, I'm just going to keep going on with my life and have this pain in my arm constantly. Like, that is our
Mm,
uh, stuff that's holding us back. And you can't move forward until you look back at your past and look at what's causing your present behaviors and your present experience. And a
mm,
lot of times it's a wound you got in childhood that you didn't have the capacity to resolve as a child. And therapy is a great opportunity to give yourself that space to heal it.
yeah.
And it's transformative. I feel like going to therapy is like the number one thing that has changed my life.
Good.
It's the
I'm happy that you
foundation.
like found that because I
Yeah.
think it's hard to like
Yeah,
navigate.
it is. And I think with the mental health care system, that's a hard thing to navigate. Like, Mackenzie Drazen, who founded Team, the mental health nonprofit I work at, her whole business is helping young people connect to the right mental health care
Mm,
because it's so hard to find the right mental health professional. And a lot of us give up on that journey.
mm,
But when you can find the right modality of therapy, whether that's cognitive behavioral therapy or EMDR, which is eye movement desensitization reprocessing therapy, which helps heal trauma, whatever that is, or hypnosis, whatever it is that helps you take care of your mental health, just keep going until you find it. Like, I tried a lot of different things before I found the right thing.
mm.
And you just got to keep going to find the right thing.
And explore. figure out your
Yeah.
options. Yeah.
Yeah, and treat it as an exploration and an experiment. Like, if this
Yeah.
doesn't work, okay, there's nothing wrong with me. I just haven't found the right thing for myself
Yeah.
yet.
And you're learning
Yeah, the
more
whole
about
thing is
yourself
learning.
as you go and everything.
Exactly,
Yeah.
which is great. Like, it's never a bad thing to know more, learn more about yourself.
Yeah.
And I think the more you learn about yourself, the more you learn about other people in the world. I think there's this Carl Jung quote that says, in order for a tree's branches to stretch up to heaven and to the sun, its roots have to stretch down to hell.
Hmm.
And that's an analogy for our mind. Facing the darkness, going down into the roots of our darkness in our minds is what's going to enable us to access the flow and
Yeah.
the higher states of being. And you can't just like bypass it. You can't just, because I've tried.
And you
I've
go
tried
right
to.
back to it.
Yeah, you go right back to it. And it's actually not a bad thing. It's like when you have like an open wound and it's sore, if it
Yeah.
gets nudged on, and that's your body telling you, hey, you got to heal this. You got to take care of this. This is
Yeah.
something that needs your attention. It's a good thing. It's
Yeah.
not getting in your way. It's actually your calling card to transformation for yourself.
Speaking of like going into the past, I'm curious to know, like, do you believe in like past lives?
Um, I'm not sure. I read a book, I think Oprah recommended it, Seed of the Soul. I remember I told my sisters, I was like, I think I was a smoker in the past life, and that's why I have this health condition that affects my lungs. And my sisters just laughed at me. They're like, you're being so dramatic. But I do think,
You're like, thank
like,
you. I'm
they're
trying.
being, they're being so, no, they're so good. They really ground me when I get all, like, uh,
All up
overwhelmed by
there in your
things.
head. Yeah.
Yeah, I think I definitely believe, okay, I'll tell you what I do believe, because,
Okay.
um, I do believe in the sense of you are meant to meet who you are meant to meet. Like, I do
Hmm.
believe in destiny. I believe in there's people that I have met in my life that I feel like I've known them my whole life, and then they're
Hmm.
total strangers. So I do
Hmm.
believe there's some kind of connection. And I do believe that there was like my family, I feel like we were always a family in past lives. If there are past lives, I feel like you
Hmm.
do feel, I don't know, like it's just that there's a sense of connection there that you feel that's deeper than where you are in this present moment.
Yeah.
So yeah, I've definitely felt that with many people in my life, of this really deep connection of knowing someone, and they really know you even though you've just met.
Mm. Interesting. I want
Yeah.
to talk about that a little bit with you because I feel like, I don't want to assume, I feel like there might be a little bit of a light bulb that might, you're not aware of, that might go off when we talk about it. Obviously, my life path has been very different from yours, and I went through different things. Learning about past lives has been so, like, I want to say overwhelming, but also very just like, it's been relaxing in some sense because it's just like, okay, that would make sense for how my life is playing out now. And it's like, like I go to a Reiki girl. I have my level one Reiki.
Oh, cool.
I go to an astrologer. We talk about it all the time. And like my Reiki girl's like, "Do you want to do past life regression?" I'm like, "Not right now. I need I need a second." You know, it's weird to talk about because it's so up there. It's not something that's tangible that you can be like, that makes sense unless you understand it through it growing with your spirituality. So I think if you were to get into learning about your past life, it would boost you in a way that would be so much more helpful. With what you're doing is amazing, but I think if you tried it, I think it would just open your world up to different things, and the perspective that I've gotten from it is just so great because like, not to like get into my past life thing, but like what I was told, my family
Yeah,
was reincarnated, so me and my family have been family in the past life.
very cool. Are you
So
guys
whatever,
close? Are you a close family? Like, do you guys all get along?
we are we all have our own personalities, but at the end of the day, we love each other, and whatever we do, we're always gonna still be there for each other. It's one of
Right.
those. We're
Yeah.
crazy. We're Italian, so it's
You're
it's a lot.
Italian. Okay.
You know what I mean? So, um, what she told me, it was funny. She was like, in your past life, you guys were like a spiritual leader in some sort. So I've been going to my astrologer for like 3 years now, and
Wow.
yeah, it's honestly, people think going to astrology and like, oh, like it's fluff and butterfly. No, like every time I've gone, it's been like she says good things, and other stuff it's just like, fuck, like, why am I going through this? Why, you can choose what you want, but like that's how I'm experiencing it. But she just said like, you guys were always not the center, but like people came to you for things.
Hmm.
People came to you for that guidance, and then you had a script that you had to stick to, and then that's it. If someone was throwing you off, you always went back to your script of saying, well, if you do this, this, and this, you're good. And then she's brought to me like, you would always in your life, you would always, if something was going wrong, you just picked up your shot and you went to another point, laid it out, and then found new people.
Oh, wow. That's interesting.
Yeah, so she said that to me, and that was making sense in this way because what I realized was I found myself making decisions quickly and changing right away.
Hmm.
So, like, something I really thought about it, but I didn't actually physically go through anything that was challenge. I've been through my challenges. I don't want to say I haven't, but like I could have went through a little bit more of the challenge to get to the other side, but I stopped that because I said, you know what, I don't want to do this. I'm going to do something else.
Right.
And
Okay.
that has been my biggest struggle because that's what I did in my past life. That's
Oh,
what was so
interesting.
easy to
Okay.
me.
So it helps
So
you
she's like,
identify patterns from your
yes,
past that
it,
you
it
can,
helps me personally because it's intellect to it versus like, oh, you're gonna find someone, oh, it's gonna be
Oh,
fine,
okay.
like,
Yeah.
you know what I mean, like
Yeah.
the fluff is nice, but it's more just like kind of piecing it together in a way. So she said that to me, and I was like, oh shit, like that kind of like I get how that could make sense. And it's just like your life is not the same as it was before. Like your life in your past life was one way, and in this lifetime it's flipped opposite. So you have to learn a different way, and like even like going back to like what you said about, you have destiny and people in your lives. Anyone you've met, whether it be a love relationship, a friendship, someone you see down the street and you say hi for like 3 seconds or a conversation, we've all been reincarnated and we've all experienced each other in our past lives.
Very cool.
So it's very interesting because then it gives you the perspective of how maybe some of your relationships are, and it's like, oh, like, okay, that makes sense. Like my nonna, nonna means grandmother in
Yeah.
Italian, but
Yeah.
I love her so much. There's like, I had this some sort of like sister relationship with her.
Aw.
I don't know how to explain it. Like
Yeah.
she's crazy in her own ways. She's fun in her own ways, but sometimes I'm like,
All known
I
as
look,
art.
we look,
All known as art.
yeah.
Yeah.
But like the way that we talk to each other sometimes, I'm like, are you okay? Like I'm not even kidding
Aw,
like
I
that. And she'll
love
say it to
that.
me too. It's very like a sibling
Yeah.
relationship.
You
And
get
like,
each other.
yeah. But we're
Oh.
also like, you know what I mean? Like she says something like crazy and I'm just like, you're fine. Don't worry. But like, and then the astrologer brought up to me, she's like, she was like your sister in your past life. I'm like,
Oh.
that would make sense, you
Yeah.
know?
Wow.
So I feel like you would like that. I
Yeah,
don't
it's
know.
very cool. That sounds so cool. And it seems like a great way to make meaning of your life. And also
Yes.
in a way that enables you to see the patterns of behavior you have and how you can correct them presently. To see, okay, maybe
Yeah.
I shouldn't quit when things get hard. I should keep going.
Yeah.
And yeah.
But the hardest part about that is, yes, you can do that, but you don't actually know to a T what you're supposed to experience in this lifetime.
Right. Yeah.
So that goes back to the whole letting go of like, okay, I gotta just try it out. I gotta figure out a way to live the way that I'm supposed to live in this lifetime versus what I've learned previously. I can take what I have, whatever level I'm at with it, and be like, okay, I can apply it, but I can't act on it as I would in my past life because that's not what this life calls for.
Yeah.
You know?
Yeah. Yeah, it makes sense. I think that's so sweet though that you and your grandma were
Yeah,
siblings. I love all that
exactly.
stuff. That's
Uh-huh.
so sweet. Do you know that there's this app called The Pattern? That's like a really cool
The
astrology app.
pattern.
Have you heard of it?
No, I
You would
never
love
heard.
it.
Yeah,
It's really cool. I'm not a big astrology person, but there are things about astrology. Like when I say that, I'm saying that like I'm not like
aware of it or into it.
knowledgeable.
Yeah, yeah.
Yeah, like, but there are certain things that on this app that I'm like, wow, this is literally exactly what I'm going through right now. And it's
Yeah.
just, it's nice to feel like there's a sense of direction.
There's
Like
an
when you
acknowledgement
feel
outside
lost.
of yourself that you're
Yeah,
trying to
yeah, it's
acknowledge
cool.
yourself. Yeah.
Yeah, like even there was, a couple of months ago, I was going through like a lot in therapy and working through a lot of things. And I just was like, oh, like I just want to have fun for once. Like I'm in my 20s, for goodness sake. Like, can I just live? And in this pattern app, it said, you're really fun, you love fun and adventure and playfulness in your life, but this period of your life is giving you depth and giving you meaning. And reading that for me just put it all into context for me and just really helped me move through a difficult moment. And I feel like that's a really great thing that astrology can give you, or looking at past lives,
Yeah.
or even like things about your astrological sign. Like I'm in Aries, and there's so many things I read about Aries, and I'm like, oh my God, that's me.
What's your
Like that is like,
what's your rising sign and moon? You know?
well, I don't know. I'd have to check my app. I
All
have
good.
it all on it. I'm so sorry. I don't even know. Like I just know that I think there's Gemini in there
Oh,
somewhere.
okay.
There's
So I honestly, this is my third time recording an episode for this podcast, but I was just talking about a little bit of what it is. So basically, for you have three main signs. You have your rising, your sun, and your moon. Your rising sign is how
yeah,
you're perceived as to the world.
right.
Your
Okay, yes,
sun
this is all
sign,
coming back to me.
yeah, your sun sign is your personality, and your moon sign is who you are to your core.
Hmm.
So
Yeah,
that's why when you see two Aries in a room, they're completely different. Even if they're born on the same day,
yeah,
there's a difference because
that's true.
we're all different, obviously, but like just
Yeah,
the
yeah,
way
yeah.
that everything was set up in your chart is the energies that bring out certain aspects of yourself and this and that. So
Hmm.
like it's interesting, you know?
Yeah, very. Yeah. No, I remember feeling that way when I read that in this pattern app. I put it in like a couple years ago, so
Mm.
I don't remember exactly. But yeah, there's Gemini somewhere. There's another thing. But yeah, it's cool. It's very interesting to me, all of that stuff. But yeah, I am no
But even
connoisseur of
like
that.
going to your what you were talking about, like your 20s and stuff, like I'm going through the same
Yeah.
thing. It's like my 20s
Yeah.
have been uh, lightly put it shit. And it's like what I understood is there's a certain planet that takes like planets go around the sun a certain amount of years and times different than others. So I think there's a certain planet going through our chart that's making our 20s difficult. And that's why some people around us aren't going through that. They have yet to do it. Maybe it'll happen when they're 50, 60, or they might even not go through it in this lifetime, you know? It just depends where everything's set in your chart and what energies bring out. So like for us, unfortunately, we're going through it in our
Yeah,
20s,
I
you know?
think,
It's
yeah,
not a
I
bad
think,
thing, but it's like,
well, it's normal though, right? Like
yeah,
the 20s are supposed to be hard. And I think it's actually reassuring to know that, because and I think the 20s are hard. Like I've spoken to my parents about it, and they're like, yeah, the 20s were hard for me too, because you have to figure out what you're going to do for work. You need to figure out who you're going to marry, if you're going to marry. Do you want to have children? Do you want to make X amount of money? Where do you want to live? Where do
mm,
you want to like manage your stress at work, take care of your health? Like there are so many factors, and that's just like scratching the surface of it. But
yeah,
there's so many factors that are super important pillars of your life that we have yet to get like solidified. And
yeah,
that's normal. Like that's the 20s are your time. I don't know if you follow Gary Vee, but he's amazing at
mm,
speaking about just like taking hold of your 20s and just seizing it. He talks about how you could literally do nothing until you're like 27 and you'd still have a ton of time to figure it out. And I feel like we have this pressure in our minds of, okay, by 30, I have to make it. By 30, I have to figure it out. By 30, I have to get married. By 30, I have to figure all these things out. And I feel like instead we should just treat the present as a time to figure ourselves out. And that can be a
yeah,
great gateway into the life we want.
yeah,
Because I think it's easy for us, especially with social media, and I think how our generation has grown up, it's easy to define your success on what you have.
yeah,
And going through what I went through a period where I had nothing. I didn't even
mm,
have my health.
yeah, that's hard.
But but it's about who you are. It's about who you become as a person. That's the most important thing. Does it really matter if you get $1 million if you're miserable? Don't
Yeah,
you want to become someone who can enjoy the $1 million if that's your goal?
yeah,
Like, don't you want to be someone who really can can thrive under pressure, who can, and that's something that you don't just arrive there. Like, failure is a huge part of the process. That's normal. And I think we need to normalize that more. Like, I went through so much failure. I still go through failure, but I'm learning and growing through that. And that's what matters. That's what the 20s are. That's why they're hard, because we haven't mastered stuff yet.
Yeah.
And that's okay. Like, that's
Yeah.
normal.
Yeah.
We don't, how could we expect ourselves to be perfect?
Yeah.
Like,
I think the hard part for what you just said about the failures for me
yeah,
personally, I don't know if anyone can relate. It's hard to take a failure as, okay, this didn't happen, let me try again, versus, oh, this isn't working for me, and changing route. You know what I mean?
right.
I find myself in that struggle of like, maybe I'm too nuanced and I'm like really thinking about it way too much, and I'm just like, it's like the littlest
No,
things. I'm like, maybe I should do
yeah,
something else, and then again,
right.
back to past life stuff. But that's been the struggle for me personally, because I'm just like,
Mm,
is this a setback because I need to look at it differently, or is this a setback
right.
because it's not what it's meant for me? And then
That's
that
a
itself is
really
an internal struggle.
That's a really great point you brought up, because it's true that we need to figure out, okay, does this mean I should quit and try something new, or does this mean I need to persevere and move forward?
Yeah. It's like
Yeah.
between trying to figure, it's like, do I need to figure it out or just need to look at it for what it is? Majority
Yeah.
of the time, just looking at it for what it is, I need to work on that. But you know what I mean? It's just like,
Yeah. I think
it's hard.
I read this thing in the 4 Hour Work Week about Tim Ferriss wrote it, and it was really interesting. One of the things that I took away from it that helped me answer this question was, give yourself 6 months. Give yourself 6 months and go hard in something for 6 months. Try it.
Mm.
And if by the end of the 6 months you want to keep going, and you feel like this is something I'm genuinely, like, my attention is on this. I'm genuinely curious about this. I want to keep growing. I want to keep moving forward. There's been hard moments, but overall it's getting better. And this is something I really enjoy and want to keep doing. Keep
Mm.
going. But if you do something for 6 months and you're like, I'm just not feeling it. Like, this is, you can honestly say to yourself, I can move forward. I can leave this
Mm.
behind. And for me, that was when I was 19, I tried method acting. My agent recommended this method acting class. And I tried it for 6 months. I said, okay, I'm going to give myself 6 months. I'm going to see how this goes. And after the 6 months, I realized this does not resonate with me. It's not something I want to move forward with. Done. Peace.
Mm.
I quit. I let go. And throughout that whole process, there were moments where I was like, is it me? Or is it this thing that's just not resonating with me? And after the 6 months, I realized, you know what? It just doesn't resonate with me. And that's okay. And I move
Yeah.
forward. And there's other things that like screenwriting, for example. My sisters and I, we published a young adult novel, and now we've adapted it into a screenplay. And it's been 3 years
That's
of,
cool.
thanks. And it's been 3 years of learning how to screenwrite. It started during the pandemic. In the first 6 months, we were determined to figure it out. And,
Hmm.
and through those 6 months, it didn't get to a point where it was like, it's not resonating with me. We hadn't reached any level of success yet, but we were learning, we were growing, and there was just this excitement and enjoyment for us, and a connection there that we felt. It really resonated with us, this whole journey
Yeah.
we were on with screenwriting, and we just wanted to keep going. So I think that's a great indication of whether or not you should proceed with something, is if it resonates with you. Does this
Yeah.
resonate? Like, and also ask yourself, why am I doing this? Because
Mm.
that's a great indication. Like, am I doing this because X, Y, and Z said I should? Is it because I'm saying I should do this? Or is it because there's something in me that's called to this, that really feels connected to this thing? If that makes sense. I don't know if I'm making sense with that.
No, 100%. Yeah. I'm like listening. I'm
Yeah.
focused on this. Yeah.
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 Yeah,
If I
because
look
it's
like I'm
hard.
not
No,
listening, I'm
no,
definitely
no, no.
listening.
I just want to make sure I'm coming off like,
Yeah, yeah. No,
that
you're
I
right.
that
I'll
I
ask my
comprehend.
questions. Don't
Yeah,
worry.
no, good. Because it's also like, there's this. I read this somewhere where it's like, you shouldn't be shoulding all over yourself. Like, it shouldn't be should. It should be
Yeah.
like, it's this feeling of like, I must do this. I have to
Yeah.
do this. Like, and a
But where does
great.
that come from? I want to
It
ask
comes.
you.
Yes. Well, I think for
Is that
me.
coming from a place of this is what I need to do, or is that coming from a place of I need to control my situation?
Yeah. So I think when it comes from a place of control, it's not the right thing.
Oh, obviously. But I'm saying like what in that moment of what you just said, I need to do this.
Yeah.
Have you had moments where you're like, why do I need to do this?
I
Because I know
think,
that will go back into where's it coming from. I know it's a big
yeah,
cycle, but like,
no, yeah.
has it been like, you know?
I think for me, it starts with what captures my attention. And you don't have control over
Mm.
what captures your attention.
Oh, no, not at all.
You don't.
Yeah.
But it's a great indicator to you of what to follow. Because what
Mm.
captures your attention, you can't explain it. Why did screenwriting capture my attention? I don't know. Like, I actually can't
Mm.
tell you. But all I know is that I was fascinated by it.
It's
And
just a
there's
world
just
that just
something,
like brought you in.
yeah, it was something about it that I couldn't not think about it. I couldn't let
Mm.
it go. I had to see it through.
Explore it.
I had to explore it. Like, even the same thing happened with me with dance. Like, I remember I was at a different dance studio, and then I watched my studio owner at the time. I think I was 12. My studio owner at the time said, "Oh, go watch this studio perform." So I went backstage. I watched Elite Dance Works perform, and they were phenomenal. And they were my age. And I just, from that moment, it just captured my attention, and I could not let it go. It was all I thought about. I went to their summer intensive. I went to the classes. I just wanted to be like those dancers I saw on stage. And it
Mm.
just, like, I was obsessed with it. I just couldn't let it go. And I continued with that until I was 16 years old. And it's okay if something changes too. Like, when I was 16 and I went on backstage and I went on set, all of a sudden that captured my attention. And that was
Yeah.
something that I was like, whoa, what is this? I've
Yeah.
never seen this before. This is
This is cool.
fascinating.
Let's keep going.
Yeah, it's fascinating. I'd spend my lunch breaks talking to directors and producers and writers and just being
Oh,
like,
I love
tell
that.
me all you know. Like, I don't know, like, tell me.
That moment for you was probably the reason why you got into screenplay. You had
Yes.
to go through, if you weren't on backstage, I don't think you'd be that interested in
No, no,
writing. I'm
100%.
assuming not, you know?
No, 100%. And who would have thought that I could have foreseen that coming from competitive dance? Like, I didn't think, I was always interested in acting and stuff, but it's like, again, there's
Mm.
just, you just kind of you have to follow what captures your attention, because that's going to
Yeah.
connect you with your passion. And I don't think you can go wrong with what you're passionate about.
For me, it goes back to the flow thing because I do love dance. I've been going through a change where like I don't want to teach anymore and I haven't been
Mm,
teaching. And it's like the conversation I've been having with people, they're like, "Oh, why don't you?" I'm like, "I don't know. Like, I just don't want to do it." I'm like, when I
yeah,
say I love to dance, like, I love just playing music and dancing. Like, after this phone call, I'm gonna do my thing. I'm gonna blast my music and just be in my own world for I don't know how long.
yeah,
With also thinking about a trillion other things on my computer, but like, just, you know
right,
what I mean? That's always
yeah,
been my world. So it's kind of just like, not holding on to it, just like being with it until something resonates that makes sense for me to do.
yeah. And I
But
think,
then that just comes back from the control I feel that I'm doing. So it's kind of just like, just getting out of that cycle of that, just being like, okay, just
yeah, yeah.
enjoy and just figure it out as you go.
Yeah, and I think it's also okay too to normalize. I'm talking about having this, like, calling to doing things. It's normal too to just try stuff. Like, you don't need a calling to just try stuff and see if it resonates or not.
Mm.
Try a bunch of different things. Like, I like, when I left dance, I tried a bunch of different stuff. Like, my mom's an entrepreneur. I'd shadow her at her business meetings, and then I'd go and try take some acting classes, and then I'd go and try to write, and then I'd do some speaking, and then I'd, like, you kind of figure out what resonates with you by trying, and that's not going to hurt you. Like, knowing what you don't want is good.
I think I got into the space of knowing what I don't want and then focusing on that.
Mm.
Because I feel like I know people talk about the art of saying no.
Yeah.
Some people get comfortable, and I got comfortable saying no because it felt good being in control, but it was just
Right.
like I was creating distance between the opportunities that consciously and subconsciously I wanted, but I
Right.
didn't realize I was doing that because I was so happy being in control of saying no,
Right. Yeah, that's a powerful
you
thing to
know?
discover.
But it's like discovering that and then sitting with it. I think that's you can you can have so many nuances that go through your brain, and then once you understand it fully, it's kind of just going back to the whole flow of just sitting with it and being like, what am I doing? Like, what
Yeah, what's going
is what
on?
am I purposely, I'm not purposely doing this, but am I like, not to be harsh, but am I ruining what's supposed to be meant for me,
Yeah,
and
right.
that kind of just takes you in a little bit of a loop.
Yeah,
I don't know
yeah.
about you,
Yeah,
but
for sure. I think, like, it's important to reflect. I think it's important to reflect on your behavior and ask yourself, is this helping me or is this hurting me? And sometimes it's hard
Do
to
you find
know.
yourself do you find yourself getting being in a stage of reflecting too much to your own detriment?
I think I can catch myself. You can though. I think it's a balance of reflection and action. Like for me, I will
Yeah.
take one day, like I will take my Sunday and I will reflect. Or if it spontaneously comes up, right? If there's like a thought and you're like, oh my God, I just discovered this thing, write it down and reflect and then move forward. I think taking action is really important. I think you should actually be in action more than you are in reflection. Because reflection can
Yeah.
just like action is what's going to inform your reflection,
Yeah.
you
Okay, that
know?
makes
So
sense. I
I
like
think,
that.
yeah, like it, if,
I like what you just said.
yeah, right. But it's good. It's good. Like it's easy to
Yeah.
get in our heads, like, and just like you just got to go forward and you're going to figure it
Yeah.
out.
I want to play with your brain a little bit. Going back to what you talked about, doing something for 6 months and
Yeah.
then deciding then and there.
Yeah.
I have a question.
Uh-huh.
What, how do you feel about doing something for 6 months, deciding then and there if it's right for you, and then waiting another 6 months and revisiting it?
So you're saying like do something for 6 months and then keep going another 6 months?
No. So you went through the 6 months
Yeah.
and you said, okay, I either like it or I don't like
Right?
it. You don't know what life's going to bring you then and
Yeah.
there. What if you went another 6 months
Yeah.
and came back to that
Yeah.
idea?
Yeah. Yeah. No,
What do you think about that?
that's normal. That's totally normal. I think I can't remember the exact term for it, but there's this thing where your interests circulate. So like,
Hmm.
you're interested in dance, for example, and then you're going to go and explore all these other things and then you're going to come back to dance. And then you're going to explore all these other things and then maybe you're going to come back to another thing.
Yeah.
Like you're just going to keep coming back to things. Some things you'll come back to and some things you won't, but you can't predict that. Like for me, public speaking was always something I did. I did a lot of work for the Canadian Cystic Fibrosis Foundation when I was
Hmm.
young. I got a lot of experience doing that. And then when I was 12, I came to my parents and I said, I don't want to do this anymore. I just want to focus on dance. I want to be a normal kid. I don't want to do this. And my parents were like, okay. And when I turned 19, I came back to it. And then I let it go again because I was going through therapy and I was going through a really hard time. I was like, I don't want to talk about all the hard stuff I've gone through right now. I just want to live. And so for a year, that's what I
Yeah.
did. And now I'm back to speaking again. So, and that's actually normal. I think, you grow through these phases of your life. And then when you come back to it, you are a more informed person and you have more to contribute
Yeah.
and more to add value and you have a deeper connection with it than you did prior. So I think that's really normal. And I don't think there's anything wrong with, it's not like 6 months, something doesn't resonate with me. I'm like, that's it, never again. It's just right
Hmm.
now in this moment, it's just not resonating with me and you can't force that. I think that's okay. And then you might come back to it later and that's normal, especially in our 20s. I mean, I think across your entire lifetime, I feel like that's a cycle, but yeah, totally normal and it's not bad in my experience.
What you just said, do you find yourself knowing these things prior, but then hearing it again hits differently, and then you're just like, I knew this, but how come I didn't see it this way? Or how come,
Yeah.
you know what I mean? Like, how does your brain work, or how do you process things
Yeah.
when you're like, I heard this like 5 months ago. Why
Yeah.
did I process it now the way that I did?
Yeah.
Because like what you just said, I know. Like
Yeah.
I've known that for
Right.
a long
Yeah.
time. But you saying it now,
You're
I'm
like,
just like,
oh.
I'm aware of me thinking it differently. I'm like,
Yeah.
where were you a year ago, 2 years ago? You know what I mean?
Yeah.
That's my own struggle and
No,
issue,
no, no. That's
obviously,
normal.
trying to
That's
perfect
that's
things. But
normal. By the way, that's normal. I'll
yeah,
give you an example.
how do you deal with that? Because
Yeah.
I'm just
Yeah.
like,
I think you kind of got to get there on your own, right? I think it's this has happened so many times with me. Like, you're not the only one, Dan.
yeah,
I remember my sisters and I in 2022, we were trying to get a literary agent, and we went through like 5 different drafts of our script. And every agent we sent it to, they were like, "It's not good enough. It's not good enough. You got to do X, Y, and Z. You got to change this, change that." And we were working so hard. Like we spent the entire summer working. Like we didn't have a summer vacation. We were
yeah,
working, and nothing was working. And
yeah.
my mom randomly was like, "What about that Masterclass app?" Because there's this app called Masterclass. I don't know if you've heard of it, but you would love it. Um,
Oh, with all like the celebrities and
yes,
stuff.
yes.
My friend bought a
Oh
membership
my gosh,
back in
amazing.
2020, and she had a free one to share. So she just messaged me, she's like, "Do you
Yes.
want to?" Like, absolutely.
Yes.
Watch Alicia
Oh yeah.
Keys,
Yeah.
Periscope. You
So
know what I mean?
cool.
Like, I loved
Yeah,
it.
I loved it
But
too.
yeah.
And my mom mentioned, like, we saw an advertisement for it, I think in July or June. And it was like the Duffer
Hmm.
Brothers who wrote Stranger Things. My sisters and I love Stranger Things. But for some reason, it just went over our
Hmm.
heads. And
Yeah.
then, like, 4 months later, 5 months later, my mom came to us and said, I just saw this advertisement for Masterclass for the Duffer Brothers. You should take it. And after trying everything, my sisters and I were like, okay, we got to try this. Like, we've literally tried everything. Let's just try this. And taking that Duffer Brothers masterclass, we wrote a script that actually started to get positive feedback for the first time. And that was
Amazing.
huge. Like, we sent it to producers
Yeah.
and screenwriters, and they were actually liking it and like wanting to be a part of it. And that was like, we had been failing for 2 years, right? So, yeah,
Yeah.
I totally get that. And, you get there and you're like, why didn't I, think of this earlier? Why didn't I see it? But we sometimes need to, like, get something out of our system and like think through something, try something one way and realize that it doesn't work, to try and be open to the new thing. Because even going back to
Mm.
like therapy, and I say, oh yeah, it would have been great if I did therapy when I was 8. But if 8-year-old me was told, oh yeah, you should go to therapy, 8-year-old me would be like, fuck off. Like, it's not
Yeah.
part of my language, but like, she would have been like,
You're like,
no way. And she wouldn't have been,
I don't need
yeah, she
therapy.
wouldn't have been ready. I wouldn't have been ready. So I think
Yeah.
things come to you at a time when you're ready for them, when you're ready to hear it. Because, yeah, you've
Yeah.
been thinking about this, like this particular thing for you, Dan, like we were just talking about. You're like, yeah, where were you 2 years ago? Where were you a year ago? But you've been thinking through it.
Yeah.
And then suddenly, also sometimes, like, I'll hear some things.
We get in the way of ourselves though.
We do.
Because like talking about it, like what you just said, like it wasn't hitting right. I think that's why a lot of people are in the realm of like you have to be present. You have to,
Mm-hmm.
be present because like that opportunity, we don't know, but like that opportunity came up already for
Yeah.
you. The universe pushed it again to give it to you again to be like,
Yeah.
hey, we gave this one. You know what I
Yeah.
mean? It's like I'm not saying every time when you meditate and take breath work and all that stuff, you're gonna get things right then and there,
No.
but like it's gonna be more frequent than
Yeah.
what you're doing because like you're not allowing,
No, yes.
and then that's the whole
Yes.
control thing
And
and blah blah
speaking of
blah. But
control, I'm going to share a tool that's helped me because I have a tendency to want to control things too. And
hmm
I think it's just a perfectionist thing, or maybe it's just an age thing, whatever. But there's this thing called a heart aligned meditation. And anytime
mm,
I've done a heart aligned meditation in my life, I have had a more positive experience of my life. It doesn't mean I don't have hard days, but overall, everything's a lot easier. I feel
mm,
more in control without being controlling, and I manifest the things that I want. Like the last time I did a hardline meditation, I got backstage, which was insane because I had
mm.
no acting experience prior. Like I shouldn't have gotten that. Well, like technically, but I
The nuance of
manifested
it is
it
like technically, but yeah, I get what you're saying.
technically, but I also worked really hard and all that kind of stuff.
Yeah.
But what I'm saying is that, and it's interesting because I recently listened to this podcast talking about how CIA agents used heart aligned meditations to help them in their work, which is like, you don't think about that, but
Mm.
it helps them be more powerful, connect your mind and body
Present,
and spirit
aware.
together. And
Yeah.
it's the heart is key. It's not the head, it's the heart.
Mm.
And so there's this heart aligned meditation by Kimberly Schneider that I've been doing for the past couple of months, and it's called heart coherence. So it helps you. They actually like measured this specific meditation in studies, and it improved the participants' heart coherence by like 30% in a month.
Mm.
And by improving heart coherence, it connects your mind, body, spirit. Like it's so good for your health. It's so good for your mental health, your physical health. Like, and I've felt a significant difference. And that's like the number one recommendation I can give to anybody. It's like an
Mm.
8-minute meditation. And I do it every day, or at least 6 days a week. Like sometimes I like to give myself a day off because I don't want to be like hyper vigilant about it either. But
Heart health is so important. Like the other
so
day,
important.
the other day, I was just looking at something talking about, how bodybuilders like building their muscles so that they're strong when they're older and stuff. A lot of them pass
Yeah.
away because their heart health is terrible. That's
Yeah.
why do
Well,
you
from all
see,
the steroids.
yeah, well, if they take them or not, but 100%. But
Yeah.
just like, bodybuilder, anyone who's building their physical health, they're not taking care of
Yeah.
their like internal health. Like,
Yeah.
yeah, you have all
That's
this
huge.
muscle, but like, what's pumping all the nutrients to it? What's, you know what I
Yeah.
mean? So like
Yeah. And on
old
an
men are skin.
energetic level.
Yeah, what you have these old men that are like twigs, but they're up and going at like 90
Yeah.
because their heart health is
Yeah.
way better than everything else. Like that's what keeps
Yeah.
you going, you know. So it's
Yeah.
interesting that you brought that up because it's important.
It is. It's probably one of the most important things to start with is that. But then you also need to take, like, again, like, I think sometimes when people think of spirituality, they think of a monk who's
Just
meditating in a cave,
yeah,
right? And like
just sitting there.
outside of society, and like it's so easy to become perfectionistic about it. And I
Yeah.
also think that it's easy to feel a sense of, I feel like sometimes, in the spiritual community of people, there's a sense of like, I'm superior because I, meditate or I do this. And the funny part is that I think spirituality is really, at the end of the day, about connecting you with yourself and connecting you with others. So if
And
what
that's
you're
gonna
taking
look
away,
different for everybody,
and that's
which
going
is
to look different
hard.
for everyone, but I
Yeah.
think that's the goal. Like, that's the idea.
Yeah.
And I think if that's not what you're taking away from it, there's some interpretation there that's missing, because I've encountered people who say they're spiritual and they're horrible. And they
Mm.
think that it's because, oh, I meditate, therefore I am a good person, or I am a
Yeah.
superior person. I read this book, therefore I am better than you. And that's not how it works.
Yeah.
And I know people who have not read, like my grandmother, my sisters, they don't read anything on spirituality, and they are some of the most spiritual people I know, because it's how they treat people. They have an amazing connection with themselves and other people. And when I say connection with yourself, like you're talking about connection with your past life, connection with your astrology sign, connection with all these aspects that make you you.
Hmm.
And then that deepens your connection with your grandma. That deepens that
Yeah.
connection with all these people and parts of your life. And that's a beautiful thing. That's really what it's about in my experience.
And on the opposite end of that, realizing what's actually not that deep.
Yeah, exactly. Not
Because we're
everything is that deep.
yeah, and it's you have to find the balance between that. Because I've had my fair
Yeah,
share of being not deep and then too deep, and it's like
right.
there's different levels for everybody, and
Yeah,
unfortunately, I would assume you are very developed in your spirituality and who you are as a person. A lot of people in their lifetime are just going to hit a ceiling point, and they won't even either grow from that, or they don't even grow at all. And it's like that's just what's meant for them, and it's like hard to see that and be
yeah,
okay with that because you're like, oh
yeah,
shoot, you can't help them because it's like
yeah,
that's not what's meant for them, and it's like,
yeah.
and
You
then
got to meet people where they're at.
yeah,
And
that's
it's
a
hard.
hard
That's
part.
hard. Like, it's so hard. Like, I've seen that with my mom, like some close people to her, like, oh my gosh, it's so difficult because, again, it's about connection. You just want to connect with people. I've had
Yeah.
experiences where someone is so judgmental of themselves and other people, and I've even experienced it with myself, right? And I'm mindful of the fact that replacing judgment with compassion and empathy is a really great gateway to connecting with yourself and other people. But some people just, they don't want to hear it. They don't want anything to do with it. And that's hard, because you're like, we could be best friends right now. We could be connected right now, and you're choosing not to, from a place of fear.
And that's us trying to control.
Exactly. So
And then
it's
it's like
it's
again, it goes back to the cycle. You're like, oh, just chill, just
no,
relax,
seriously. No, it's so true. And I think the
just
most important
relax.
thing is like identifying what's within your control, and then
Yeah,
just focusing on that, and trading
yeah,
your expectations for appreciation.
yeah.
Just and for me, like, that was a huge thing for me the past 6 months. I went on a dating app in January because I'd gone through like all this crazy
Trash.
health.
They're all
Yeah,
trash.
no, but yeah, which I discovered. But I went through, so I went to a couple of my friends and I asked them their advice. I was like, okay, I'd love to get back into dating. It's been a minute. I've been through all this crazy stuff. I'm finally feeling good. What do you recommend? And from a lot of women, I got, like, some of them are marrying the guys they met on Hinge, and like they're really nice guys and really like positive experiences. So I thought, okay, go on this particular dating app, and try it out. And it was 6 months of, I would not recommend. It was terrible, but it taught me so much about myself. And what I took away from that experience is that I can only focus on what I can control. And from
Yeah,
that, I changed my energy from trying to find a partner to trying to take care of myself and give me all the things I was looking for in a relationship or thinking that I would get
Yeah.
to in a relationship. And that was like a huge transformation for me. And I've been doing that, the past, whatever, since July, I guess, of this year. And it's been huge. It's been transformative because it really forced me, like, not getting what I wanted and not, I hardly went on any dates, and the dates I went on weren't great. And, yeah, it just showed me what I needed to do, what I needed to change, which was just my relationship with control, my relationship with my expectations. And that was a super freeing thing because once I let all of that go, I was just like, I'm just going to live my life. I'm just going to take
Yeah.
care of myself. I'm just going to treat myself the way I need to be treated. And that's all I can do. And I'm not going to become resentful and bitter and upset at all these other guys' behavior because it's not my responsibility. Like,
Yeah.
so it had to happen, but I'm really grateful for the fact that that became my takeaway. And it was just
Yeah.
like, and that's when I started doing the Heartline meditations and started to just connect with myself again. Which I think is the most important thing. Because, like,
Yeah.
whether you have a partner or not, what relationship do you have with yourself? Like, that's what matters.
Yeah.
It's not whether or not you have something. It's how connected are you to your experience of that thing, whatever
Yeah.
that thing is.
Yeah. Are you a relationship girly?
What's a relationship, girly?
Just you love being in relationships, like on
No,
a no, not at
no,
all.
no, no, no. I am not. I
You
didn't go
like
on
your
my first.
independence.
I love my independence. I actually have a very healthy relationship with relationships. I don't
Good.
think I'm a relationship girly, and I don't think I'm an anti-relationship girly.
Okay,
I'm just
good.
in a place of open to anything. I'm
But still
okay with.
having your core values of what you want.
Exactly.
Yeah.
I'm not the kind of person that changes my personality based on who I'm dating. I am not that person. And I have a very strong gut instinct. Like, I will go on a first date and I will know right away, and my gut is always right. And I just trust my gut. I just trust it. And I'm not judgmental. Like, I come from a very, like, non-judgmental place when I'm very mindful of that when I'm on a date with someone. And if my gut, and sometimes it doesn't make any sense. Like, you could be, like, I've been on dates with guys who are, like, the most perfect on paper, but there's something in my gut that's just like, this doesn't feel right. It's not even anything bad's happening. I'm just like, I can't. There's something in me that's like, I get me out. I don't want to be on this date anymore. I don't want to see this person again. They're not a bad person. There's something here that doesn't feel right. And it has
Can I
never led me astray.
can I ask you something with that?
Yeah.
Um, I've had this conversation a few weeks ago with I think it was my Reiki girl, and I was telling her I'm like I have a hard time differentiating when something is my gut feeling
Hmm.
versus when something's an anxiety.
Oh, that's a great point.
Because yes, you it's literally in the wording, your gut feeling. Your gut's part of your nervous system. Your nervous
Yeah.
system responds to whatever an anxiety. Like I don't
Yeah.
know, maybe you haven't thought about it like because I recently have just been thinking like you can tell I'm an overthinker already, but
It's
it's just
okay.
like
I know
when something
I've been
is
there.
yeah, like when is something truly a gut feeling versus anxiety that you don't want to deal with?
Yeah,
Like
no,
how
it's so
how do you
true.
even
Yeah.
you know what I mean? Like what's that how
Yeah.
does someone differentiate that? Is that something where you just have to again sit with and experience or
Yeah.
I'm being very honest, I don't truly know. Some
No,
things
yeah.
aren't that serious for me on a mental state, so if it
Right.
just feels whatever, I don't care.
No,
If
and
it's
some
really like
things,
bothering me, I'm like,
yeah.
what do I do? You
Yeah.
know?
Well, so I think it's two things. I think one is, like, when it comes to, like, the anxiety scale for yourself, put it in a scale of 1 to 10. Like, if you're anxious about something, like, how important is this thing? Like, let's just, I,
But
like, a
then
lot of
in
times with
there,
myself, I'm like, it's not that deep. Like, let's just, like, if I'm anxious about the breakfast I'm going to have in the morning, like, let's just, like, keep it at a 1 out of 10. It's okay. If you have yogurt instead of eggs this morning, you're going to be okay, right? So that's, like, a small example. But I
mm,
think for me, I, like, I had
it's an interesting question because like
it
I've thought
is.
about it. I'm like, that's
No, yeah, I think, okay, I'll just tell you what I've experienced and we can figure it
okay.
out, what we think.
Perfect.
Um, So two things. So one is that I did experience social anxiety, and I have been a very anxious, like I'm not an anxious person, but I've had moments in my life where I've had a lot of anxiety, like to the point of having like full blown panic attacks. Like when I was
Mm,
18 or 19, there was like 2 months in a row where I was in a movie theater and I had a panic attack in the movie theater. Like it was
mm,
terrible. And then there's also social anxiety, right? I don't know if you've
mm-hmm.
experienced social anxiety. I went, like when I was 17, I had social anxiety, and I went to a Second City improv class, and my social anxiety went away. And I think it's the sense of like,
Comfort
yeah,
at the end of the
well,
day. Yeah.
well, it's not even comfort. It's that social, like you realize that social situations are awkward and they're funny, and
Yeah.
you can just like roll with, like it teaches you to just like roll, like the yes and. I don't know if you've heard of that, like yes and,
The
but
song
it's
or the saying?
yes and not the song.
I heard the song.
Yeah, so basically that. Yeah. So yes and, like someone says something and you're kind of like, what is this person saying? You just go along with it. You're like, yeah, that is funny. Like it taught me that it's not that deep.
Mm,
So like most social situations, you know, the ones that you get anxious at, that you're like, I don't know any of these people here, like it's not that deep.
I get that.
It's
Yeah.
okay. And you can just like, the fun with it is just like treat it like an improv thing. And you know, from that, like the lessons I learned from that of just like, yes and, yeah, yeah,
Yeah.
I got to stand on my shirt, and now I'm self-conscious about it, and I'm about to meet this person, and they're kind of, they have a bit of an attitude. Okay, well, they have a bit of an attitude, and I'm going to do my best to get through this, and that's okay. Like it's normal to feel anxiety and social anxiety. Just don't let it stop you. And I think for me, how I determine whether something is just anxiety or a gut feeling is I talk it out and I get a second perspective. I always, like,
Mm,
if I get anxious about things really easily, and I will talk to someone I trust and tell them, this is what I'm feeling and this is what is happening. What do you think? Like, am I just getting wound up about this? Like, do I actually need to be anxious about this? Do I need to make a decision about this? And through talking it out with somebody, it enables me to come to a decision. And 9 times out of 10, it's like, oh, I'm just being anxious. I'm okay. And then sometimes
mm-hmm.
it's like, oh, okay, like my gut, it's actually my gut telling me something.
Yeah.
And then another thing is, like, I call it like this 3 strikes rule. So if it's like a reoccurring situation for you, maybe you go on a couple of dates with a particular person, maybe you're at a job and you're going, or there's a particular altercation you're having with a coworker, give it 3 strikes. So the first time there's something, you feel something in your gut, right? Like, when you're like, maybe there's anxiety around the gut feeling because you're
Mm,
like, get me out of the situation. But there's something there that's telling you there's something off here. Okay, maybe I'm just having a crazy day, but I'm not gonna forget about it. If it happens again, okay, I'm noting it. Maybe something weird is happening, but again, like, there just could be
mm-hmm.
something weird going on. If it happens a third time, that's a very clear indication to you that there's something wrong and there's something that needs to happen. Whether that's you
Yeah.
leave, whether that's you change your attitude about it, whether that's you have a conversation with somebody.
I think, sorry to cut you off, I
Yeah,
think that's important because
yeah,
you said 3 strikes.
yeah.
Naturally, my brain went to the third strike out.
Right. But
It's
it's
like,
not
no,
always
it's not.
out.
You know what I mean?
Yeah.
I get people can relate with that. It's just like the
Yeah.
third strike doesn't mean see you later. It
No.
means there's something here.
There's something here. Yeah.
What are you gonna do about it?
Exactly. And again, like that'd be a great
I'm
time
like
to
writing that down.
Yeah. No, it's a great that's when you reflect. That's when you
Yes.
sit down and think about it, and then also talk to someone about it, because it's great to get a third, like a, objective perspective on what's going on, because it's all in your head and
Yeah.
you're thinking through it, and then someone who's seeing it from the outside can very clearly see what's going on, and they can very clearly
Mm,
help you figure out what to do next. So yeah, it's just like
yeah.
it honestly, like the gut feeling is telling you something needs to happen. Something needs to change. I don't know what it is, and that's for you to figure out. But yeah, maybe sometimes it is leaving. Like sometimes it is you got to go, but sometimes it's something else. And that's okay.
Each situation calls for something
It
different.
does. Yeah, and I think
Yeah.
like when you're dealing with a toxic coworker, it's pretty clear what needs to happen. A boundary needs to be set. You need to set
Mm,
you got to teach people how to treat you. Don't talk to me like that. You don't need to
yeah.
be rude about it, but just stop. Like that, you've been rude to me 3 times in a row now. Please stop your behavior. That's not okay.
Yeah.
Or like if you're, toxic family members, like on my mom's side, she's just dealt with that and it was insane. And like she had to leave because with, again, this is a great determining factor to see if you need to stay or go is, can this person actually, like if that, you have a gut feeling and if it's like, okay, I got to talk and have a conversation with someone. If that person in that conversation does not respect your boundaries, does not hear what you're saying, does not want to do anything to accommodate you, that's a really big sign that you should probably get out if you can.
Yeah.
Because there's no connection there. It's like talking to a wall. Like I've been there where like there's people in my life that I've just been like I've tried to set a boundary and they just keep going. They keep trying to hurt me. They keep trying to behave in a way that's hurtful even when I communicate that. And so when that happens,
Yeah.
it's like you kind of got to, if you can, walk away.
Yeah.
Yeah.
I think I've had an interesting run with relationships in that sense because I'm gonna talk about the past life again because yes, like I've that's what I've done in the past where if something wasn't right, just pick up my shop, go somewhere else, and then
Right.
figure it out then and there. So that's what I come into this lifetime with knowing. So it's like I've had situations. Well, when the moment happened, I would be like, no, I'm gonna figure this out. I would try to have a conversation, and it just went downhill super fast.
Wow.
And right away, I was just like,
Yeah.
that could have been. Now looking at it, I could have took the opportunity to still work towards it and figure out what it is instead of reverting to okay, this is not it,
Yeah.
and then building a whole um, energy and awareness of what it is outside of it versus just be like seeing it for what it is, So
Yeah.
like it's difficult to like.
Yeah. Difficult.
It all depends who you are at the end of the
Yeah, and
day,
I also think like there's ways to have difficult conversations that don't end in them being really terrible at the end, like and going downhill right away. I think that's a skill we can all learn. I think that for me, difficult conversations used to be something that went downhill pretty quickly because it's easy to get really defensive. Even if someone's being honest with you, like the truth hurts. It's easy to just be like, oh,
Yeah.
I don't want to, like, no. But I think self-awareness is really important, and I think how you frame difficult conversations is really important. I read this book called Difficult Conversations by these two Harvard professors, and it was really cool because they talked about one of the things they talked about was intention versus impact, and how sometimes we intend to come off a certain way, but the impact is different, and that's where a lot of the disconnect comes within conversation. Like if someone tells you that shirt doesn't fit you, you could easily interpret it being like, oh, are you calling me fat? Like, you're saying I don't look good?
Yeah.
Whereas that person could actually be like, where they're coming from is actually
They're a designer. They work with
right.
it.
Or like, they're like, you are amazing. You could wear a way better shirt than that,
Yeah.
But all the words you hear, like, it can be different, right? And then that's where
Mm.
the conflict comes in because one person's coming from a place of kindness, but the other person interprets it as judgment. Like, that
I
happens.
I I relate to that because I remember in the past, like I growing up, I had different friend groups, and when I
Yeah.
say different, like I had people from like elementary school and then
Right.
high school people and then dance friends. Like there was just different community. Like I just that was my world.
Yeah.
Um, I remember one time, I don't need to get into detail, but I was just saying something to someone and like I just directly said what the issue was
Mm-hmm.
and how I am. I'm not a dick, but it comes off blunt.
Right. Yeah.
Like, oh, like, why would you? I think so. One of the stories was like my friend wore a white dress to a club,
Uh-huh.
and she's like, my boyfriend got drinks all over it.
Uh-huh.
First thing I said was, why would you wear a white dress to a club? Like it gets dirty. And like, it wasn't like an attack. It just, that was, I don't know why.
Right.
It was just my first thought. I was just
Yeah,
like, oh, don't
yeah.
wear a white dress.
Yeah.
And she got offended because it was just like,
Right. Yeah.
she took
Classic
it like she's like, why
example.
do I have to wear a white? Why do I have to do that? Like I wanted to wear that, and it was
Right.
just like it kind of like went
Escalated.
in a yeah, and I was just like,
Yeah.
oh, I want to put a hold on that. When you deal with something like that, where it's like I didn't intend to do that,
Right.
and you acknowledge that you're at an awareness mentally where you can acknowledge how the situation is, but that person is still on the level of like, why would you say that?
Right.
How do you navigate that? Because I found my ways, but like
Yeah.
I know a lot of people can be like, I've been in situations where like I don't want to say yelling or whatever. It's been like a heated conversation,
Yeah.
and I'm kind
Yeah.
in my head. I'm kind of just laughing because I know it's not that serious,
Right.
and I
Yeah.
know there's something that the person's doing themselves, not in a judgmental way, just like I can see the blockage that they're giving themselves.
Right.
But then it's like it's still thrown on to me, like, oh, you shouldn't have done
Yeah.
this and that.
Yeah.
And it's
Yeah.
just kind of just like I guess that goes into the boundary thing, but like, how do you take that?
Yeah, I think just like becoming like for me what helped me was becoming aware of the fact that it was a thing. Because I think before you're just like, something triggers you and triggers them and then all of a sudden you're in and you're like what are we even doing? Like this and then all of a sudden
This
shit
is
hits the
silly.
fan.
We don't need to talk about this.
Yeah, yeah. So I think for me like I'm not a hothead but like I can easily get
You're an
in.
Aries,
I'm an Aries. Yes,
the
I'm a
Ram,
spicy Aries,
the
goddess
Ram.
god of war, right? So it's just like that is my like I can easily
That's your
like
nature.
that's my nature. Like I was at a serving job for like a year this past year and there was one particular coworker that was a bully and I'm the kind of person that like even if they're not bullying me, they're being mean to someone else, like I get mad and I'm like that's not cool. She should
Yeah.
not do that. And I would stand up for myself and then it would turn into this like sparring match between her and I. And it was like nothing was resolved. Like she was in an authority position. She was my supervisor.
Yeah.
So like and she would seek it out. Like she would try to like get me going. And my sisters were at the job with me and they are like water signs. They're so chill, so calm. They really cool me off literally. And they are like, girl, like just calm down, let it go for a walk. And I noticed through the serving job how I deal with it is I will just go like even if I'm in my own household, like I live at home, there's 5 of us in this home,
Hmm.
things can get heated sometimes. And I just go for a walk. I distance myself. I'll like play music if I can. When I was at work, I would just avoid the particular coworker as much as possible. I would just get busy working, serving. I would walk, and within an hour at most, I would cool off and I'd have a very clear perspective on what was going on.
Mm.
And I would not feel the urge to engage in conflict. So that's my biggest piece of advice is when you start to like butt heads with someone, just be like, time out. We're just going to take a time out. We can talk about this in an hour. I'm going to come back to you or we can talk, but like set a time. Like if this is someone you love and care about, set a time. And like I've done this with my parents even. Like, okay, I'm starting to get heated, you're starting to get heated. I'm going on a walk. We'll talk about this later. We'll talk about this tonight. We'll talk about this at another time. And it always is so much better when you talk through it once you both have calmed down. Because if you're both coming from a place of heightened emotion, it's you start to get
Yeah.
illogical and it's just like and it's gonna you're just gonna get hurt. You're gonna hurt each
Yeah.
other. So that would be my biggest recommendation is just like cool off, but also set a time to talk because it's also about communication, right? Like it's important to communicate. Don't just like shove it under the rug and pretend it didn't happen. Just set
Yeah.
a time to talk about it when you both are just calmer about it. And
Yeah.
also I think to view it as like it's us versus the conflict, it's not me versus you. We're on the
Mm.
same team. We have some kind of misunderstanding, some kind of miscommunication. Let's figure this out together and be a team about it. And then that way it doesn't put the blame on anyone else for the conflict. It's like, okay, we both have something that we need to sort out here. Let's sort it out together and be a team about it. But you got to calm down first. Like
Mm.
like that is like the most important thing I can recommend if you can do it. Because if you just go
Yeah.
deeper into the conflict, it's just like then it gets into name calling or character assassination and like you say things you regret and it just it doesn't make things better if you can
Yeah.
avoid it.
Yeah. Madison, oh my goodness, like I was just thinking this that before you ended off there, I'm like, I've seen you at competition so many times. I'm like, if only we had this conversation back then, I think we would like be great friends because like
Yes, I
you know what I
know.
mean? And then that goes back
Yeah,
to the whole like, where we are at right now conversing wouldn't have been the same
No, not at
when we were
all.
16,
No,
you
like
know?
I wouldn't have been. I was in the thick of it back then. I wouldn't have been able to
Yeah,
say anything.
I know.
And dance was actually a great way for me to channel a lot of rage and anger. I
Mm,
recently looked back on some of my performances from like 10 years ago when I was 15. And I was like, oh, I was angry, but I was able to
yeah.
channel it in a healthy way. But like
Were you
when
aware it was anger?
yeah,
Yeah.
yeah. But I channeled it and I just like put it all into like my performance, and I'm proud
Mm,
of that because that's a healthy outlet. Like it's
mm.
a healthy way to process um, anger. But
I didn't
then
realize, sorry to cut you off, I
yeah,
didn't realize how much movement helped me.
yeah,
Because when I stopped dancing, and
mm-hmm.
I was still dancing in high school, so I stopped
Right.
in grade 11, and then grade
Okay.
12 I was dancing, but like
Yeah.
after high school I went home, and like I went from busy to like barely doing
Nothing.
anything.
Yeah.
I didn't realize, like you said, this was anger, it's my outlet. For me, it wasn't my outlet for emotions. Like now I get it was, but like I didn't realize how much physical energy I was
Yeah.
escaping my body when I did it. So that when I stopped, I was starting to feel like that year after I stopped dancing, I was like depressed because like I was like,
I felt the same when I stopped dancing. It's like the
but it
post
wasn't.
dance
I knew,
depression.
yeah, I knew I the situation for what it was. I knew it was the right thing to do
Yeah.
for my circumstances, but just physically, it brought me to, like you said, like you took your medication and everything just came up. For me, things were
Right.
coming up because I wasn't
Yeah.
moving.
Yes.
You know.
No, I felt the same, and like dance was my coping mechanism for so long, and then when it no longer was available, I had to find new coping mechanisms, and I think that's
Do you
important.
think? Do you think, in a way, yes, it was a coping mechanism. Was it a suppression at the same time?
I think
Like
it.
that, like coexist.
I think it was a distraction. Yeah,
Yeah,
because I don't. I wouldn't say
I
suppression
would take
because I
distraction
channeled it.
as yeah, but like it was channeling it, but it was
It
what
wasn't
the way I
healing.
see that.
Yeah, it
No, it
wasn't
was just a
healing.
cycle. Like you
Yeah,
went up and then you came back and then you did it again. And
exactly.
that's what I'm saying.
Yeah,
Was it a suppression then?
probably. Yeah,
Yeah,
I think if I had been in mental like therapy at the time of dance, I think it would have been more healing. But
yeah,
I think after dance, yeah, I had to like all the stuff that I didn't deal with was coming up, and
mm,
I had to take care of my mental health
yeah.
that
I
way.
bet.
Yeah.
Well, anyways, thank you so much. Is there any links or tags you want to share with whoever's watching this? They can see your profile or all
Yeah.
that stuff.
I'm on Instagram at Madison Macgregor. McGregor's MAC. It's not Conor McGregor. It's not the MC. I get that a lot. It's not the Irish McGregor. It's the Scottish McGregor. MAC. So yeah, Madison Macgregor on Instagram. And then we also have our mental health page at myteam.social on Instagram. It's a great resource for mental health. It helped me transform my mental health, and it's really great guide points for just day to day taking care of your mental health. If you're dealing with a really difficult situation, if you're supporting someone with mental health, it's amazing. And it's backed by mental health professionals. So I highly, highly recommend that.
Awesome. Madison, thank you so much. This was great. All the best to you.
Thank
Hopefully we
you.
bump into each other
I hope so. I think
and we
we
get to
will.
continue this conversation
Yeah.
in different ways. Yeah.
100%. Thank you so much, Dan.
Thank you. Have a great day.
You too.